This new procedure is the most advanced device to treat painful diabetic neuropathy. Dr. Ben Wehrli, a podiatric surgery specialist in Palm Desert, talks about this new technology and how it helps with long-term neuropathy pain relief using a nerve high-frequency stimulator.
Nevro nerve stimulator is a treatment for painful diabetic peripheral neuropathy. It's a new innovative technique that allows us to treat diabetic neuropathy in a way that we've been able to do it in the past. Painful diabetic neuropathy is a condition where the nerves essentially dysfunction in the way that they communicate. So the patients will have some numbness that is associated with some burning sensation, typically pins and needles, and an overall just uncomfortable sensation. Our current treatment that we have to treat painful diabetic neuropathy, it does very poorly at treating it. So patients either don't get the pain resolution that they would like, or the side effects from the medications are so severe that they stop taking them. This is the first treatment that is non-pharmacological that actually has been proven in a randomized controlled trial to make the pain sensation significantly better at a high percentages.
How does someone with diabetic neuropathy qualify for this procedure?
There are some prerequisites, meaning that diabetes need to be under control. They need to have failed 2 oral pharmacological treatments, which typically most patients do. The trial is a temporary 10-day trial period that we implant the leads, and then we're able to monitor the benefit of that over 10 days. And at that point in time, if they get a benefit from that, we can then do a permanent stimulator implantation. My role is to identify the patients that would qualify for this, to make sure that they've tried their pharmacological treatments, and then make sure that I manage their crossover to actually getting implementation of the stimulator. This procedure takes 10 to 15 minutes, which is minimally invasive, no incision is needed, with minimal downtime.
How have your patients benefited from this innovative procedure who suffer from painful diabetic neuropathy?
My patients have benefited greatly from this. Even after the trial, some of them have had zero pain. After that, they're able to start to feel their feet again. They're able to start to get back to regular shoes, walk barefoot. So it's been pretty remarkable, the outcomes that we've been able to get. This is the first time that I'm excited to see patients show up on my schedule with painful diabetic neuropathy, because we have an option for them that significantly improves their quality of life. It's very satisfying for both the patient and the physician.
Dr. Wehrli talks about the device.
HFX iQ is the only artificial intelligence basis spinal cord stimulator system that gets smarter over time, learning from your patient's responses. Essentially, that means that on a daily basis, your patient is actively inputting their pain responses, and the computer system gets smarter and adjusts it to target their pain.
What is the current data on the nerve stimulator?
The current data on this is 85% of the people were responders, meaning that they had a 50% reduction in pain, and then 70% of these patients, which was an incidental finding, had sensation benefits at 2 years. What that tells me is the potential to decrease amputation, proprioceptive and balance issues that lead to hip fractures. That could be something that saves a ton of money for insurance companies and patients, and it decreases morbidity and mortality. My patients, when they get to me, are very frustrated. They've tried everything under the sun, multiple pharmacological treatments. They've tried lasers, they've tried different treatments without really any benefit. And this actually works. If you're a patient with painful diabetic neuropathy, call my office. I'm excited to get you in, make sure that you qualify, and get you through the protocol to get you protected and out of pain.
For a free consultation, call Dr. Wehrli at 760-848-8231.